Because adversity is often the breeding ground for development, dive into Neurointerventional Stories, the uncensored interviews. Our guests, all leaders in the field of neurointervention, share the difficulties they face, the complications they have had to manage, and speak without filters on little discussed, sometimes controversial, or simply taboo subjects. Hi everybody, my name is Nanthiya Sujijantarat, and today we are with Dr. Michel Frudit from Brazil. Dr. Frudit, how are you today?
Good. Nice to be here with you.
Nice to meet you as well. Just to give an overview of your path and what you did to get here, can you tell us a little bit about yourself?
Yes, I am a neurosurgeon in the beginning, and more than 30 years ago, and I came to France after finishing my residency in neurosurgery. I'm talking about 1997 to 1999. I spent 2 years here with Professor Casasco and Professor Moret, and I've learned the technique since the beginning. The most interesting things at that time was the remodeling technique, things like this.
And coils just came out not too long ago before your training.
Yeah,
right?
yeah. Coils, the first case we did in Brazil was in 1996. Our group did the first case, the first case in Brazil with the GDC. At that time, you had to make a specific course to be approved to use the GDC. I did it in Oxford. My colleagues did it, I think it was in Swiss, I don't know. But you had to be approved to use the GDC.
What did your early practice look like?
I was always interested in vascular pathology. In neurosurgery, it was my passion, anatomy and vascular pathology. So I was in the cath lab looking the angiograms. At that time, people were beginning to do femoral access because in the beginning it was carotid, direct puncture. And I was interested about that. I asked them to teach me, and finally I was doing myself. Because in Brazil, you can do radiology, interventional neuroradiology, being a neurosurgeon. Many countries, like in Europe, you should be a radiologist. But in Brazil, you can be neurologist or a neurosurgeon or radiologist.
So at the time that you actually graduated from Brazil and you're coming to France, were you one of the first neurosurgeons that they've trained? Have they trained any neurosurgeons before?
I think not, because older doctors that came here were radiologists. I'm not aware if there were other neurosurgeons. I was studying at that time AVMs, so this was the subject of my PhD, and I did a thesis about this with glue. Not with Onyx. Onyx was just beginning in the 2000.
So I imagine that when you were in residency, you did a lot of open cases. And you came out, and it was really not common for neurosurgeons at the time to go into endovascular. What was your drive behind seeking out the fellowship specifically in this area?
I can say that there was a Congress of Neurosurgery in Brazil, and the invited was Fernando Vinuela. And he just showed us the first cases he did embolizing basilar tip aneurysm. So I was fascinated about that because during my residency, the cases that were operated all were severely injured or died. So I had to talk with him. And I say, how can I do this? I want to learn. And he said, this is a great field. If you want, you should go to this field. So this is the beginning.
You were ahead of the curve, way ahead of the curve.
Yeah.
So I'm curious, so you've had this very long, successful career. What would you say was the most challenging aspect of it all, if you have to pick one thing?
Looking to the past, I can say that I had chance because I had a great chief in neurosurgery. I had a great partner in neuroradiology, Dr. Guilherme Caldas, who always was with me and pushing me to learn more, to come to France, to come back and work with him. And here I was supported by all those fascinating doctors, Dr. Casasco at the Pitié-Salpêtrière, and after that with Professor Moret at La Fondation Rothschild. I think they gave me great support. I think they liked my job, and I am grateful for them for that.
When you went back to Brazil to practice for the first time, what was the landscape like? What year was that?
At that time, there were other guys working already, and I had to find a space to begin. And it's not easy when you are young. People don't trust you too much because you are young. But in the beginning, it was good. I was working at the university. And those guys, already famous guys, were working in private hospitals. So I went like working in the background, with few resources, but having good results and working hard.
I know that you have done a lot on a hemorrhagic side of things, and now you're kind of transitioning to doing more ischemic. I'm curious to know, in Brazil currently, in ischemic stroke, if there are any new developments recently.
Yeah, we began to work on stroke even before those publications of 2015. We were doing, but not in the public health system, just in private ones. The problem was in the beginning to convince the neurologists that it was good for the patient because they thought that the TPA was the best thing to do. And I heard from some good neurologists that they didn't need our small toys because the powerful of TPA and rehabilitation was better than thrombectomy. So in the beginning, it was difficult to convince them that it was important to give a chance for the treatment. And then after the publications, they had to change their mind and everything was begun to be more organized in the private hospitals. And the challenge now is to organize our public system. After the publication of the Resilient trial, I don't know if you are aware of this, but it was something that the Ministry of Health asked us to do a trial to prove that this treatment, thrombectomy, mechanical thrombectomy, will be as effective in Brazil than it is in other countries. So we had to do it. It was difficult to do, but we proved it. We have the same results, the same clinical results, the same reperfusion rate. So it was a landmark for us, and I think we are proud of that because in the conditions we have, it's really difficult to have good results.
And now, how many centers perform thrombectomy now in Brazil?
Now, they just approved it and will be reimbursed by the public system. And now 12 centers are going to work. Most of them are in the south of the country. In the north, I think there are just 2 centers. And the majority of the population is in the south and southeast. But we have to increase that.
So you practice in both private and public hospitals. I imagine there are some differences in access to care in terms of stroke thrombectomy. How do you reconcile between them?
There are big differences. Brazil is a country of contrasts. You have very good hospitals like you have in the US or in Europe for people who pay an insurance and have money. And you have poor hospitals for people that are not covered by insurances, the public health. So now we are reimbursed for a fixed price and we have to choose between aspiration or stent retrievers. You can use, but sometimes this will be a problem if you use more than it's reimbursed. This is just beginning, the organizing of the system. We still treat a lot of people outside of the good window. We treat people in the late window because it's not organized from where the patients come, references. So this is a work that will take time to organize the system.
How were the adoptions affected by the results of, you mentioned, late windows, so it sounds like dawn is creeping in and making a difference. What about large core, posterior circulation, all the expanded indications? How are the adoptions?
We are thinking about this in our center. I can tell you what's happening in my center now because we have limited resources and we have to choose. Our results from the Brazilian trials, even in the extended window, show that in older patients, our results are not good, over 70 years old. As we have limited resources, we have to have local protocols. Because it's not because in the US or in Europe it's good for treat patients over 80 years old that it's good in Brazil. It's better to keep the resources for maybe the people that will get more benefit. In private hospitals, you can do the best treatment with aspiration, balloon guiding catheter, 2 stents. You can do the same things you do here.
What was your proudest achievement in your career so far?
To be recognized here, to be invited here is something very special for me. You see, there are not many Brazilians, not many South Americans that present cases. We did live cases for the link since 2016, I think. 16, 18, last year. So to be part of this selected group of doctors is something very special for me.
There's certainly, it seems, increasing representation from your country every year I come here.
Yeah. This
wonderful.
Is something we are organizing to in our country, the centers that are forming fellows. In our center, we have 2 new fellows each year, so we form 2 per year. And during the last more than 20 years, we formed most of the doctors that are around the country. Mm-hmm. It's a network I think it's a good network of good people.
So we're nearing the end of the podcast, and we ask the same questions to everybody. So the first question is, if we can take a journey through time and go back 10 to 15 years, what do you think you would have done differently?
Collecting data is something very important. Now I see that there is a lack of data, that I could have been more attentive with that. For publications, the follow-up of the patients is also something very important. To have good relationships, this is something we already do, but it could be better with other colleagues. But I'm proud of my career. I think I'm okay with that.
If we fast forward 15 to 20 years, how do you imagine the field will evolve?
Things are getting easier because of new devices. Things are getting more reproducible. At that time I came here, I spent 2 hours to go once a month to Caen to see Professor Terron treat 1 carotid. The stent in the carotid was something amazing, and that guy was capable to do. Today our fellows do it. So that's not because he was not as good. The thing is that the procedure is more reliable, more easy to do, and this is the future. It will spread, and we have to train people. We have to do simulation. We have to get better devices and to do trials and include other countries to participate, not just US and Europe. I think there is value in other parts of the world.
So was the impetus for Resilient trial because there's skepticism about implementing those 5 trials in a landscape that's different from the US?
Yes,
okay.
yes, yeah. I think the government thought that it was impossible to do in Brazil what they were reading in the papers. And it was really difficult because it was an effort, because our system is not organized. But we were there to do it fast because we had an 8-hour window. And we have to be fast. We have to take the patient for the emergency and bring them ourselves.
So the limitation was that they're worried that you won't be able to transport someone as fast in that setting.
Yeah,
I got you. Okay, that makes
sense. And technically, they thought we are not able to do the same as in the first world.
Yeah. Gotcha. If we now turn our attention to the training of the new interventionalists coming out today, what do you think we don't do enough or say enough to them?
I think we have to prepare them for working in real world. When you are in the hospital training, this is not exactly what you will face when you go to your private clinic. So I try to bring them to my world. Come with me and see how I work outside of this hospital. I think this is important. There are things we don't teach. They have to be with us and see.
Now, we've discussed several difficult topics, so we're going to end on a positive note. What initiative, person, advancement has most inspired you or impressed you in the recent months, and what would you like to highlight to conclude this episode?
I see things in a positive way. I think that everybody is capable to do good things for the others. That's our mission. And if I had the opportunity to work with brilliant people, I was paid by our government to come here to France, and I gave back this to our people. So I think this is very positive, and I think I can inspire the new generation to do the same.
Well, thank you so much, Dr. Frudit, for your time today.
Thank you very much. It was wonderful for me.